అందిస్తోంది శంకర ఐ హాస్పిటల్. ఇందులో 75% పేద గ్రామీణ వారికి.
So we said we'll finish and then go back there.
It's process where we for a community outreach program, we go to the doorstep, we identify people, so it is all automated. We collect data at the doorstep itself. We built our handheld app and everything, all data is integrated. So across 14 hospitals, we can understand what is the prevalence of the disease, what sort of a age group that people are getting this disease, and then we intervene on a targeted mode. So that area we focus and conduct our outreach program.
And artificial intelligence we are using in a big way, sir. Diagnosing diabetic retinopathy, our field workers can do it. Diagnosing cataract, we have a app called, all our field workers carry an iPod and an app also, sir. I'm from that, sir. A lot of AI we have brought in, lot of research we are doing, sir. Lot of research.
And voice-based feedback also we are using to understand the sentiments of responses and take necessary actions on it.
And teleconsultation with the village satellite centers we have, sir.
Now we are working a program now, Sanjeevani.
I heard about that.
That is with Bill Gates, he wanted to work with us,
Okay.
TCS. One parliament we have taken up now as a pilot.
Okay.
Within 6 months we will complete. Already one constituency assembly we completed Kuppam.
Okay.
Now we are going one constituency, then throughout the state.
Replicate.
All functionaries of health will be online.
Okay.
And all hospitals, everything.
Okay.
Then we wanted to clinical test of 49 tests. On the base of that, prioritization. Vulnerable sections continuously will do, and then others once in a year, and ultimately preventive, real-time monitoring, curative. Global health knowledge at doorsteps of the patient.
Great, sir.
We want to provide.
Sir,
There you can be a partner.
exactly, that's what I wanted to ask you, sir.
There you can be a partner.
Yes, sir.
How to integrate.
Yes, sir. Preventive and curative. You are also
And also real-time monitoring.
and rehabilitative also. We have started in Bangalore
Yeah.
along with Microsoft. So we need community-based rehabilitation, but incurably bright also, sir.
Anyway,
So we'd love to be partners.
Bill Gates also is working.
Yes, sir.
That is a very good thing. We work together.
No, we can. Okay.
So this is the nursing station. Take patient will come. Here anesthesia is given in the room.
Acha.
And then we have 5
Theatre, surgical theatre.
all 16 theatres are there. But we not
This is like international standard.
international students. This is a modular routine, sir. So we regulate temperature, humidity and positive pressure. So all 3 parameters are controlled because this is the heart of the hospital. So our infection rates are lower than most international hospitals, although we do large numbers. And all our hospitals are now interconnected. So the minute the surgery starts, we are able to monitor the live stream. Today we are trying to use technology to also learning curves, training. So we're using
In
AI.
India, top 3 organizations, which are all the organizations? eye care.
In fact, we have been rated as a number one,
We are the
sir.
largest.
We are number 1.
Community eye care, we would be the largest. Depends on how you define it. In community eye care, I think we would be number 1. Number 2 would be possibly Araku hospitals, and LV Prasad in Andhra is
Number
again
3.
one of the largest. There are some players in the north, but community eye care, our numbers are the highest
Acha.
across.
This year we will be doing 3 lakh surgeries, sir. 3 surgeries alone. And we work on an 80-20 model. 80% of the patients get totally free, including food. The balance 20% are those who can afford to pay.
Yeah.
So they pay for the treatment. So every paying patient supports 4 free surgeries.
Yeah.
So the hospital becomes self-sustaining. Takes 5 years, but it becomes self-sustaining. Just quickly tell
In
about
terms of technology, this is on par with the best. So we have all, where possible, imported equipment, where possible, Indian equipment. So we work with Indian manufacturers in developing not just low-cost equipment, but high-quality equipment that can be exported. So we work with Microsoft Research to create devices. We've developed an AI solutions to screen diabetes that got recognized by Government of India as one of 75 AI examples for social change. And even here, like I said, we have 107 operation theatres across our hospitals. So the minute surgery starts, Sudhakar can sit here and monitor a surgery happening in Bangalore or anywhere else. And today we are using AI algorithms to understand outcomes. So we use a lot of technology in what we do, sir. So,
Over a period of time, AI, what is the impact you are able to
Sir, AI is
Get it
helping
with
us.
outcomes. I'm asking cost and also efficiency.
Yes, so in terms of efficiency, our ability to screen more patients, screen patients early, and also identify biomarkers for possible conditions. Like today, we are able to examine the retina and pick up biomarkers for even conditions like Alzheimer's and dementia, or even cardiac risk. So we are able to expand the diseases we are able to identify. Using technology, we are able to allocate resources. So where we would send an ophthalmologist to screen, today we can train an optometrist. That image an AI pings, tells the optometrist there can be a problem. Meanwhile, a surgeon and ophthalmologist in a tertiary center can really look at that image and then give that patient, do a video call. What we've realized is patients still want to talk to a doctor. They're not happy with only technology. So we've always looked to blend both. In terms of outcomes, we've looked at using technology now in building surgical simulators also. So we partner with organizations so that surgeons can train on a simulated condition so that when they're operating on a human being, they can anticipate a problem and handle it better. And even our training curve, we've been able to shorten it using running AI algorithms on surgical videos.
You are going preventive also? Initial stage identification, and
preventive
education.
Like Dr. Ramani would have shared about the gift of vision, our largest preventive eye care program is called Rainbow, sir, where we train teachers. I think he started it in 86. So in every 500 children, we train one teacher.
For close to around 7 million students we have screened, sir. It's a very practical thing. Every school in Andhra Pradesh, we can see that the children are all screened. Involve the teachers in the first phase along with the parents. We send a communication. If there are about 1,000 children, we send a small letter, 1,000 letter to that school. The letter is on behalf of the government, on behalf of Shankar Eye Hospital, and say that for your child we are doing this. Please take care. And then every child is examined with the teachers. We give a special kit, and then those who can see well and all that as per the norms, they give a green card. Your vision is good. Those children who have a problem, which is 15%, they give a red card, saying that there is obviously some problem with you. Next stage, we send the optometrist. They check only those 15%. They don't waste their time with the normal children. And the third phase is the eye surgeons. They are brought to the hospital, whether it is simple procedure, glass correction or surgical, everything we do. And this way, the involvement of the parents also know that my child is taken care by a beautiful program like this. So they also, otherwise they don't know something happened in the school like that. So the parents' cooperation is extremely good, sir. So this is highly satisfying. We pick up a lot of cases. So for the state and real leadership, we would love to do many more such programs.
Well worked out.